Hi, my name is Stephanie Wicks. I'm going to do a neurological check on Nathan tonight. The first thing I'm going to do is I'm going to come into the exam room, wash my hands, introduce myself to the patient. While I'm talking to the patient, I'm going to be checking over his general appearance. Does he appear to be clean? Is his personal hygiene good? Is his dress appropriate for the weather? Do there appear to be any glaring mental defects? Anything like that. Then I'm going to take a Q-tip, break it in half. I'm going to tell Nathan, this is soft, okay, and this is what sharp feels like. I'm going to check cranial nerve number 5. I'm going to ask you to tell me if this is sharp or if it's soft when I touch you, okay?
Soft, soft, hard, sharp, sharp, soft, sharp.
Okay, cranial nerve 5 appears to be intact. The next cranial nerve is 7. The facial nerve, I'm going to check for facial movements. I'm going to check for symmetry. I'm going to ask him to raise and lower his forehead. And lower it, please. Okay, can you smile? Can you frown? Can I get you to close your eyes really tight? Okay, can I get you to clench your teeth? Open your eyes and clench your teeth. Okay, can you puff out your cheeks? Okay, can you keep them puffed out and don't let me push any air out here? Okay, alright, cranial nerve 7 appears to be intact. Then I'm going to check cranial nerves 3, 4, and 6. I'm going to ask you to look straight ahead. Okay, I'm going to have you look at my finger. Okay, now look past me. Okay, and at my finger. Okay, now look at something right behind me. And at my finger. Okay, now can you follow my finger? Okay, good. His eyes are reacting appropriately. They're coming in at the same pace. They're both and following my finger appropriately. I'm going to ask, I'm going to have the lights in the room turned down to dim. Okay, I'm going to check his pupil reflexes. Nathan, can I have you look straight ahead? And I'm going to shine a light in your eyes, okay? I'm looking and his pupil is reacting on this side. I'm going to do the same thing on the other side. Pupils reacting. His pupils are about 4 to 5 centimeters. They react appropriately to light. The other thing I'm going to watch is to see that both pupils react at the same time, even if light is just shown in one eye. So I'm going to go again with the light. I'm going to shine it into his left eye and watch his right pupil react. Perfect. And I'm going to come again and watch the opposite, and it reacts. The lights will remain down. At this time, I would ask the patient to stand up, and I would have a Snellen chart 20 feet away from him. He would cover one eye and read the chart for me. A Snellen chart is a chart with letters or objects, starting really big, moving down to smaller, and it's how you gauge a person's vision, 20/20, 20/40, depending on which line of the chart that they get to. You can go ahead and sit back down. Okay, I'm going to have you cover one eye and look at me. Okay, I'm going to have you look at my finger. I'm going to have you follow my finger. Okay, can you cover the other eye? And the same test would be done on the other side. Okay, another thing I want to check with his eyes is to check for his cornea reflex. So I take a Q-tip, the same Q-tip, make a little wisp here. Can you look straight ahead? Okay, and I'm going to come in here on both sides and just make sure that when the wisp gets close to his eye, he blinks, and he does that appropriately. I'm going to turn the lights in the exam room back up. Okay, I'm going to test acoustic nerve 8, his acoustic. Nathan, could you cover your right ear, kind of close it so you can't really hear, okay? And then I'm going to whisper over here, okay? Can you tell me what I said?
The Giants won the baseball game.
Okay, so I would then, you can lower your hand. I do the same test on the opposite side to make sure that both acoustic nerves are working appropriately. Then I'm going to move to cranial nerves 9 and 10. Okay, the vagus and the gag reflex. My patient is speaking, swallowing appropriately, so I know that he has a gag reflex. If my patient was unconscious, I would check his gag reflex with a tongue blade and putting it in his mouth, and to see that he gags appropriately. The other thing I'm going to have you do, Nathan, is open your mouth, okay, and say ah,
Ah.
okay, and as he does that, his uvula moves up appropriately and in the back of his mouth. The other thing to check is acoustic nerve number 12, or excuse me, just cranial nerve number 12. I'm going to have you stick your tongue out. Can you stick your tongue out, move it side to side? Okay, he moves his tongue appropriately, so his hypoglossal nerve is working. At the completion of my neurological test, I'm going to ask Nathan to touch his finger to his nose. Okay, and then touch my finger. Touch your finger to your nose, and touch my finger again. Okay, and to your nose, and my finger. Okay, so the other thing, I'm going to have you put your hands up. I'm going to have you touch your fingers to your thumbs, one right after the other. Okay, can you just do that quickly? There you go. Okay, good. Cranial nerves, those seem to be working appropriately. Now, the other thing I want you to do is take your heel and rub your heel down your opposite shin. Heel down your shin, okay, other foot. Okay, all right, good job. Okay, then I'm going to ask you, Nathan, if you could stand. Okay, can you put your hands on your side, okay, and stand. And I'm going to watch him. I'm going to stand close to him in case, but Nathan, can you close your eyes? Okay, that's good. All right, he moved forward a little bit, but he didn't completely lose his balance. The last thing that was the Romberg test. Then I'm going to ask you if you can walk forward, just walk straight ahead of me like you normally would. I'm observing his gait, looking to make sure his gait is appropriate. There's no limp to either side. Now when you walk back, go back. Okay, stop there. When you come back to me now, just walk heel to toe like that, okay? Heel to toe. I'm watching for balance, coordination. Okay, good job. Go ahead and sit down. This concludes my test. I'm going to wash my hands again, and that's it. Thank you.